Hello there, welcome to the Bristol Royal Hospital for Children. My name is Dan Magnus, I'm a consultant in paediatric emergency medicine.
And my name's Hannah, I'm one of the senior staff nurses here in Children's ED.
We're really looking forward to showing you around our department today. We're the biggest dedicated children's emergency department in the southwest of England, and we're the paediatric major trauma centre. We have a fantastic team here, and we believe in providing the very safest and best care for our patients in innovation, in leadership, in training and education, and in staff well-being.
Clearly, we're functioning slightly differently at the moment just due to the COVID-19 pandemic. Out here, Dan and I aren't wearing masks, but when we go inside, clearly we'll have to put masks on to adhere to governmental and hospital PPE guidelines. That may change when you arrive, but we'll update you in due course.
We're currently standing in the main ambulance bay. Behind you can see where the ambulances arrive and even the helicopters and pre-hospital teams behind you. And here are the lifts and the stairs through these doors up from the street level into the children's ED behind us and the adult BRI ED behind you there. But let's go inside and have a look at reception and the main waiting area. Okay, see you in a bit. Hi, welcome to the main children's ED waiting area and reception. So when patients come in, they register with our lovely reception team over there and are normally met by a streaming nurse, where they are streamed either to the east side of the department, which is just behind you over there, or to west, where Hannah's just walked, depending on symptoms at the moment. The waiting area for east currently is where I'm standing, and there's some waiting space for west just through there. You'll see over there are some patient toilets and the family room, and around the waiting room we've got triage spaces as well. So if patients are extremely unwell when they're brought in, they'll be taken through to resus, where we'll have a look at shortly, or they're taken directly through into the clinical areas. Otherwise, patients will wait to see a triage nurse and they will be called through by a doctor or a nurse practitioner. When things are really busy in the waiting room, as they do sometimes get in winter in particular, then we have nursing assistants and nursing staff who will help do vital signs on our patients. And of course, parents are encouraged to let a member of staff know if they're increasingly worried about their child. So this is the waiting area and reception area. I'm going to see you through in east shortly, but for now, why don't you head through to west, where Hannah will speak to you a little bit further.
Welcome to West. This is where we're caring for half of our patients at the moment. They're being streamed at the front desk, and then depending on their symptoms, some are being cared for here. As you can see, it's quite a big space. We've got 3 cubicles and 4 bed spaces here behind you. And then to the right, this is our waiting room at present. Behind me, you'll see computers. Some of the staff will use them to print out labels for bloods or check their emails, whatever they need to use them for. And then behind them is a big interactive whiteboard where we track our patients so we know where they are and where they're being cared for. Further behind me, you'll also see the clean utility. You may find nurses in there preparing medication or getting dressings ready for patients that we see here. And then there's a couple of bloods trolleys that are on wheels that are portable and can be moved to wherever is needed. We've got amazing play equipment here in the department. This is an example on my left. We've also got a play specialist that works within the department and will be happy to help wherever needed. And then behind that is our resuscitation trolley to serve the patients that are cared for here. Further down the corridor, there's a sneaky door that allows you to sneak into the back end of the east side of the department, but also where you'll find the patient kitchen, patient toilet, and the sluice. I'm going to hand over to Dan in East now, so he's going to show you around that area, and I'll see you again later when I show you some of the rest areas that staff have to use on breaks and where you might find some of our office spaces.
Hi, welcome to East. This is the main part of the emergency department. We've got, if you look around here, we've got 2 cubicles and 10 bed spaces here, where again patients will be streamed depending on symptoms. You can see behind me we've got the whiteboard where we do our handovers at 8 o'clock in the morning, 4 o'clock in the afternoon and 10 o'clock in the evening. We've got the main staff base just behind you here with access to digital systems, paperwork, and all of the sort of administrative clinical bits that one might need. And just down here, you've got blood trolleys for cannulation, venipuncture, minor procedures, and so on. Everything that you might need in East can be found either at the staff base or around it, or in some of the rooms over to the side here. There's a clean utility and drug room to the side, a sluice, staff toilets, and then just round the corner between cubicles 11 and 12 there, you can see a way into Resus. And the other ways into East behind me are the main doors there back into the waiting area, and this door over here that takes you into the corridor. I'm going to go to Resus, where I'm going to meet you very shortly, but for now, Hannah will see you in the corridor and talk to you about some of the areas out there.
Now, I appreciate this isn't the most glamorous place to be, but this is a corridor that you're going to get to know very well when you come and visit us here in Children's ED. On the right, you've got the consultant's office and then the sister's office, where you'll find our Band 7 nursing team some of the time. You've also got the cleaning cupboards, and the cleaners are definitely people that you would want to befriend. On the left here, you've got one of our staff rooms, and also as you follow the corridor down, you're going to find X-ray, CT, MRI, and our hospital outpatient department. You also find the main lift lobby, which is where you would go if you needed to exit the hospital or head down to either the lower levels or upper levels. What we're going to do now, though, is we're going to head through that door down on the right-hand side, which goes back into East Zone, and we're going to go and meet Dan in the resuscitation area and show you around there.
This is Resus, the main resuscitation area for the Children's Emergency Department here in Bristol. Have a look around. We've got space and capacity for 2 neonatal resuscitaires and 3 clinical bed spaces. And in this room, we have all of the equipment, resourcing and capability to deal with any paediatric major trauma or serious paediatric medical emergency.
Let me just show you around one of the bed spaces so that you can familiarise yourself. So each bed space has a scribe trolley where you'll find a member of staff during a resuscitation event writing everything down. We've also got IV trolleys and blood trolleys. You'll also see electronic screens that say Peds e-Resus. That's where you'll find all guidelines and protocols. And then we've got ultrasounding equipment, monitoring and ventilation equipment if needed. And then every bed space does have an advanced airway vortex trolley, which clearly can be used if and when needed. We also do really appreciate that this room brings on potentially anxiety or nervousness about attending work. We promised that we would never leave you in here without the appropriate support and education, and we ensure that all staff members feel comfortable before having to come and work in this area of our department.
We hope you found that tour and look around our department enjoyable and informative. We are incredibly proud of what we do here in our department and of our team, and we're really looking forward to welcoming you here either for another look around or face to face. And if you have any questions or queries, then please don't hesitate to contact a member of the senior medical or nursing team.